the Director of Terminology for the Gravity Project. We're just going to let a few more attendees come. We are just at the 1:30 Central, 2:30 EST hour, so we will begin shortly. Lucy, welcome to the meeting. We are going to join in a few minutes. Can you hear us now? We were just, I did initial introductions just at the 1:30 moment. Great.
Thank you. Gotcha.
Probably going to start at, let me just see here, just a minute or so. Just want to let people attend. We do have plenty of introductions.
Hello, this is Anju.
Welcome.
Thank you.
It is 1:32 Central. I come to you from HIMSS, where many of us in the Gravity and Civitas ecosystem have been for the last week. It is 2:30 EST. So given that we have a tight time frame today and there's some introductory material at the beginning of the call, I'm going to formally welcome all of you to the Gravity Project, Gravity Pilots Affinity Group, April call. It is of note not on the customary last Thursday of the month, this month because of many conflicts. So we are hosting it today. It is our official kickoff of phase 2 of our pilot work stream, and we welcome you all to the call. Next slide, please. The agenda is as follows. So we're going to be going through some welcome and some level setting of the new orientation of the phase 2 approach. I'm then going to be going into the Gravity Pilots workstream in general and go in deep into the phase 2 scope and focus. Again, for reference, I'll be further introduced later, but this voice you're hearing is Sarah DeSilva, who's the Director of Terminology for the Gravity Project. I'll be joined in presentation by my colleagues, Jess Little from Civitas and Vanessa Candelora, the Gravity Project Program Manager. Then we'll go into some specific questions that we have in terminology regarding gathering feedback on Gravity standards. We'll have some open discussion and then go into announcement next steps. Another, just as a housekeeping note, I do have to leave promptly with a little bit of minutes to spare because I have to attend, I have to give a speech, a presentation at HIMSS directly at 2:30 ES Central Time. Next slide, please. Next slide. Just general housekeeping. Thank you for joining the Gravity Project Pilot Affinity Group meeting. These housekeeping notes are all really customary to anybody in the Gravity ecosystem. So the Zoom meeting is being recorded. All of our recordings are always available on the group Confluence page for reference after the call. We do try to highlight the agenda and topics covered next to the Zoom recording so that you can reference it easily. We ask that everybody mute themselves when they're not actively speaking. We ask that you use the raise hand function to chime in with questions or comments and or use the chat to share. Just a note, as anyone who's attended a Gravity terminology call, know that I usually am able to see the chat, but my computer died, so I'm working off my phone. So I'm going to be leveraging my colleagues in order to help facilitate and elevate items from the chat to my awareness. Please share video if you're able, if you have a question, and if you have any technical difficulties, please contact Heidi at heidi.phoenix@civitasforhealth.org. Next slide, please. Thank you, Heidi. Per usual, I just want to note that we will be dropping relevant links and information in the chat for your reference. Sometimes because of Zoom, you have to click twice to get to wherever you want to go. We'll talk about some other barriers that might be encountered with some of those links as we go forward. So this is the Gravity Project Pilots Workstream core team. You can see there's leadership across the Gravity team. So we have myself and Corey Smith, who's the Gravity Project Technical Director, our Program Manager, Valessa Candelora. Then we have an amazing team that joins us from the Civitas and EMI, and Kate is also joins us. So we have, because of the breadth and support that we have through this current phase 2, we have lots of different experts who are able to help us. So we, Kate's going to be advising on some of the exchange elements. We have Heidi, who's the project manager. Jess is assisting with General Pilot Product Director. And then Jillian is helping lead our implementation division. And then Corey and I, of course, assisting on terminology and technical elements. And Vanessa is holding everything together as the Gravity Project Program Manager. Next slide, please. This is where we start grounding the next phase of work. For anyone who attended an info session a little bit ago, you are aware, but it's important to note here that this next phase 2 of Gravity Pilots is really built on a collaboration with our dear friend Civitas. So Civitas Networks for Health, with support from the Robert Wood Johnson Foundation, is partnering with Gravity on implementation and dissemination with a focus on public health and health equity. This includes supporting the pilot workstream and associated education initiatives. We're going to be talking specifically about the pilot workstream over the next few slides, and we'll be able to excitedly share some of the updates we've made to education initiatives later on in the presentation. Next slide, please. I'm now going to pass the mic to my dear friend Jess from Civitas to describe briefly what Civitas is and why the collaboration on implementation with Gravity makes logical sense within the goals of Civitas and our friendship with Civitas Networks for Health. Jess?
Thank you so much, Sarah. And I am also calling in from Tim, so I apologize for any background noise, but really delighted to be representing Civitas today and to be in this partnership with Gravity to help advance and accelerate the work that you all have been doing over the past years. So we just wanted to provide a brief introduction about Civitas. If you're not familiar, we are a mission and member-driven organization. I know there's a lot on the slide, so I'll break it down a bit. Over on the right, you see our members. We have over 160 member organizations across the country, just about every state, that provide critical infrastructure to support organizations and partners in their regions working across different sectors and different stakeholder groups within healthcare to use data to drive health improvement. On the right, you'll see that we also provide a number of different programs and education opportunities. So we are a federal contractor, and we have done a lot of work over the years with both federal and private funding, leveraging the vast network that we have to support implementation projects across the country, which is what brings us here today to support this great work. So around this outer circle, you'll see the different types of members in the Civitas network. We have quality improvement organizations, community health organizations, health information exchanges and community information exchanges, all payer claims databases. We have vendors and consultants that are part of our network. And we also work with a number of different national collaboratives and other national associations. We really believe that all of these different types of partners are required to move the needle to advance health and healthcare in the communities that you all are serving every day. So again, we're delighted to be here partnering on this work. I'm happy to answer your questions as we go and look forward to supporting the pilot's activity over the coming months. So thanks, Sarah, back to you.
Any questions regarding Civitas and the Gravity Civitas partnership before we move on? Okay, fantastic. Next slide, please. And if I've missed anything, please let me know. So at this point, I really want to extend an appreciation for the funding and support that leverage the pilot phase 1 work. I want to note, you'll find this later in the slides, we are committed to continuing to support any of the phase 1 supported pilots going forward, but it's appropriate at this time to extend appreciation to the sponsors and team members who supported our first phase of pilots. The sponsors are on the right there. You can see support to the ONC HL7 Cooperative Agreement, AARP, ACL, and IAG. I also want to give a special nod to the project management team from E-Advi Advisors, Evan Gallego, Gabrielle Gonzalez, and Demery Henderson, and to the pilot team technical advisor for that phase 1 work, Brett Heel from LMU. Next slide, please. Yes, a big, huge nod. Thank you from Ocean acknowledging just the incredible work that Gabby and Demry and Evelyn and Brett did in that phase 1 work. We'll try to fill the very, very big shoes. Now we're grounding in the pilot workstream scope just as a level setting. So the goal of the pilot workstream is to drive implementation of Gravity project terminology and technical standards. This is why I am here, right? So the goal of pilots is to support implementation of the deliverables and data standards that we craft on the terminology and technical division. And it's also to facilitate evaluation of those standards for continuous improvement. Anyone who's heard me speak at HIM so far knows that I have spoken very broadly about the need to evaluate some of the hypotheses we made in terminology. You'll see some questions regarding that as we go forward, but the Affinity group is that place. It's that peer-to-peer learning forum for entities participating in real-world testing of Gravity standards. And you'll see more about this, but supported pilots are those intentional relationships we have that offer TA to pilot teams and direct feedback on Gravity deliverables. In this phase 2 of work, you're going to see that we really are trying to send, as we support ongoing the supported pilots, both the pre-existing ones and the new ones, we really are trying to leverage the ecosystem that's implementing Gravity terminology and doing any implementation across the ecosystem in our pilot Affinity group as well. And you'll see that in the agendas and the meetings as we go forward. Next slide, please. Everyone's well aware of this if you're a previous phase 1 member, but this is the Gravity tiered piloting approach. The base of all Gravity pilots is the tier 1 terminology, those value sets in VSAC that Gravity crafts with the ecosystem and our stakeholder partners. Tier 2 testing is really the focus of our next phase 2 work. So the tier 2 leverages those Gravity value sets in exchange, but this exchange is not the Gravity SDOH clinical care IG, it's just any of the other exchange mechanisms. And you'll see that again in those public health and health equity pilots that we're working on as we support and continue to support those tier 3 pilots from the ONC HL7 cooperative agreement and from the LEAP award in the previous work. Tier 3 testing is the testing that leverages that SDOH clinical care IG. And again, you're going to see us looking for new implementations as we go forward. You also see us really trying to get folks to the Connect-a-thon to this, and we'll be talking about that shortly. But testing the tier 3 IG is really, really critically important, and we look forward to leveraging this ecosystem to help us do that. Next slide, please. This is the meeting schedule and approach, and the reason why I have it here as an approach is that I really want you all to see that in every meeting, we're not just leaning into the pilot, the identified pilots, but we're trying to leverage voices into this meeting that can help us understand different implementer perspectives. So we were intending to have one of those implementer perspectives today, but because of HIMs and conflicts, we don't have one, which ended up working well because I have to go speak at a presentation and very shortly. But alternating every month, you'll hear either from perspectives of analysis, such as perspectives from Pima and their study and their analysis of current implementation of social risk terminology, to direct implementations in the ecosystem that may not be direct pilots. So we really hope to kind of open up the forum, bring up the tent, and have all kinds of implementer voices in the ecosystem come and talk to us about what they're doing so we can collectively learn together. So every single meeting will basically be flipping between general analysis and direct implementer feedback as we focus on the journey of our supported pilots, both the new ones and the pre-existing ones from phase 1. You can see us also later in the fall, we'll be bringing some of the output of the implementation education focused elements with a co-design session. We'll talk more about that going forward. Next slide, please. The meeting stays the same. There's a new invite from Civitas, but the Gravity Pilot Affinity Group, supported by Civitas Networks for Health, will run from April to October. The meeting series invite has been sent, and if you didn't get it, you can always send an email to gravityproject@hl7.org or to Heidi, or you can find information on the Confluence. You can always sign up on the Confluence to get here. It will every other month than this one. It will be the last Thursday of the month from 2:30 Eastern Standard Time to 4 o'clock Eastern Standard Time. Any questions on this? All right, fantastic, sorry. Next slide. These are the highlighted phase 1 supported pilots. I really want to lean in here and support and say very clearly that we are offering ongoing support both from our technical work stream and our terminology work stream for any of the questions that these pilots have going forward, including coordinating to address any barriers they might have found in their first initial work. So we've already reached out to have meetings with most of the individuals. I believe we have this on the record. Just expect phone calls from us and meetings to make sure that we understand what your needs are going forward so we can better support you. And community, expect to hear as our phase 1 supported pilots continue their journey and bring that learning back to this ecosystem so that we can collectively learn together. Next slide, please. Incredibly excited to add to that list of really critical supported pilots and friends and partners are phase 2 supported pilots. There was a press release that went out a little bit ago, but again, the focus again is public health and health equity use cases. These are all focusing right now on tier 2 exchanges, so leveraging Gravity terminology in exchange, but not the SDOH clinical care implementation guide. Our pilots are on the left, and I'm going to go into them a little bit more on the next slides, but for right now, just know that 2 of our pilots are focusing on statewide standardized social risk screening and exchange of that information and analyzing whether intervention approaches can be included as well. That is New York State with the team lead of Bronx Rio and Oklahoma with the team lead of MyHealth Access Network. Both of those pilots are responding to regulatory requirements and incentives that kind of drive the need to do that work. University of Colorado Hospital in the Denver metro area is doing emergency department social risk screening with connections to communities, both through community referral networks and direct social work or care management referrals. And then Pima County Department of Public Health and predicament is, so the 6 New York State certified health, this is the Bronx Rio team in the state of New York. So the 6 New York State certified health information exchanges, also known as qualified entities, and the New York eHealth Collaborative are working together to implement statewide standards for the ingestion and handling of social risk data. During this process, the group, also known as the Statewide Health Information Network for New York, is planning to use Gravity terminology and coding standards to ensure consistent handling of social risk data across the state. What I want to note about this team is because the team is formed pre-regulatory requirements, we have an opportunity to learn with this team as they analyze and apply those regulatory requirements and craft responses to them. So you'll see Bronx Rio hopefully coming back really soon to just discuss some of the elements of governance, consent, process that they're considering as they anticipate the regulatory requirements coming down the pike. Next slide, please. MyHealth Access Networking team. MyHealth aims to offer standardized screening and referral to social needs at every site of care in Oklahoma using Gravity vetted terminology. By evaluating and planning for additional needs based on standardized data, MyHealth and its multi-sectorial partners can dramatically improve the health equity and utilization of screening across sectors. I just want to note here that in every single one of these teams has already been contacted with the core group from the Gravity Pilots Workstream. And just like I mentioned in Bronx Rio about the opportunity to follow with them on their journey as they respond to the regulatory requirements, there's also additional things that came out of this interview, such as the desire to try to incentivize ICD-10-CM screening and the fact that it's building off being an initial accountable community, part of the accountable community for health model. So each of these teams, again, will have initial learnings that they can offer back as they go along their journey, and then of course, direct implementation and evaluation questions as they get more further along. Next slide, please. The University of Colorado Hospital and its partners aim to improve the capture of social risk data, develop an equitable approach to resource referral delivery to address patients' unmet needs, and optimize the capacity of limited care management staff, which we can all understand, while expanding access to resources for patients. This data will also be used to inform the UHC Community Health Needs Assessment to identify patient catchment areas within high social needs. Some of the pearls that came out of this meeting was their desire to understand bias, both in screening application and interventions and referral. So we'll be looking to understand analysis of bias in both the processes and in patient care. They also hope to leverage the initial application of the screening and referral process in the ER setting to pilot sites across the Colorado ecosystem. And they also are going to be helping us learn both in the same setting about direct through community referral platform referrals and direct from social care, or from care management to social care referrals, because one is the legacy environment, which is that social care, the care manager to social care referrals off of a database of resources that we all know very well. And the other is leveraging a community referral platform. So we'll be exploring those pathways with them as we try to go forward. And the last thing is they also are working on developing clinical decision support to aid the provider of reference in connecting the patient to specific needs, leveraging those gravity intervention sets as able. So there's a lot of information to unpack here as UColorado participates in the pilot. Aim to initiate data exchange between the county and tribe within the state communicable diseases surveillance system in order to support the tribe in obtaining data to inform procedures and policies that promote the health of the tribal community. It's important to note here that there is no easy form of exchange of data between these two critical entities at this time. So we'll be first leveraging our pilot to support any data exchange because there's a need for exchange in general, and then building pathways that of course can enable social risk data exchange in time. So this is again a really critical intervention. Just note because of the complexity of multiple reporting systems with public health registries, public health clinic, Indian Health Service, and independent FQHCs, and the public health surveillance system. There's a lot of different documentation and data repositories to integrate as we work on this pilot together. Next slide, please. So those are our phase 1 pilots that we will continue to support, and our phase 2 pilots that are addressing public health and health equity use cases. It is going to be incredibly exciting. I know my mind is humming after sitting with all 4 of those initial pilots over the course of the last week and a half of helping them kick off. Correct, and they're, yes, exactly, and honoring tribal data sovereignty. I just want to make sure that that's of note. And also what I want to note too is honoring bandwidth, having solutions that do not complicate existing processes and actually support them in delivering care. Any other questions on the phase 1 and phase 2 pilots? One other note from the POSCO YAC, in line with that public health and focus, they really are desperate, and I would say they desire that community level data in order to plan those structural interventions, both from a disease specific and from a community and from a social risk specific perspective in order to address community needs. So that kind of aggregated data that we know is our third use case in Gravity is what they really want to aim at in this pilot, and we hope to support them in that. Any other questions about the phase 1 and phase 2 pilots? All right, now moving on. And again, thank you for calling out the data sovereignty element. That was a critical element of our conversation with them. So thanks for elevating that. Next slide. Okay, so now we're going to pivot briefly just to talk about an opportunity that we hope to find here in the pilot affinity group, which is, again, if we think about the work stream being both about supporting implementation and supporting evaluation, there's a couple different ways evaluation can happen. One is through those supported pilots, which have these intentional relationships where we lean in with TA, and then the team helps us analyze whether or not our implementation guide or our terminology addresses the use cases that they see in practice. And another is just to leverage this community to help us figure out whether we made our hypotheses were correct. So next slide, please. In support of the latter, Gravity Terminologies wants to honor that we very intently seek feedback on elements of our terminology to evaluate whether they meet your intended use cases. Hi, Amanda. So Amanda Lamb is one of the Pima County Public Health partners from the Pima County Public Health POSCO Yaqui Southwest Tribe pilot. Glad to have you here, Amanda. And we'll hear more from Amanda as we go forward. Very glad to have you. Very glad to have you here on the call. So Gravity is seeking feedback on elements of our terminology to evaluate whether they meet their intended use cases. Again, much of what we've done in Gravity is new. It's never been done before. Whether it's building out an intervention framework for social risks, or whether it's standardizing patient-centered goal statements, So we have a couple questions with a survey, and then we hope to convene a little small work group in order to learn more about these two questions. Are you leveraging SNOMED CT goal terms such as food security in patient-centered care planning? And are you interested in providing Gravity initial feedback on this topic? If you say yes to leveraging standards and yes to providing Gravity initial feedback, you will be included in a little reach out to form a subgroup on this element. And the same thing applies to the intervention subtypes. Do you use do the intervention subtypes addressing the core intervention types in your practice setting? So are the assistance, coordination, counseling, education, evaluation, provision, and referral terms that we built into SNOMED, are they working for you? Are there gaps? Are there definitional problems? If so, we might want to make sure that we can address and evaluate them. So in the chat, Heidi has dropped both the link to the VSAC goals value set and the VSAC procedures value set for better reference. Any questions on this? I saw some elements in the chat that I could not address because I am on my phone. Any questions before we move on?
For responsive,
Sarah?
are you
Hi, Lucy. I thought I saw your voice there. Hi.
Yeah, I put in the chat, one evaluation element might be, are there SDOH domains not yet addressed by Gravity? Is this anticipated? Gravity domains are wide ranging, but not a complete set. So will your ears be open to people saying, we need standards about this, and when are you going to get them?
You know, Lucy, that's a really good question. I want to state that, as you are aware, Gravity's funding limited our capacity to do additional domains for some time. What I'd like to do, and I've been planning this, Lucy, you're always a kind of a couple steps ahead of me, is show you the things that we conceive of and have plans for that we're seeking collaborators and funding for. And so you can see the things that are on the roadmap that everyone in the ecosystem can see are plans for neighborhood safety or for green space or for community food access or our plans for addressing immigration status or the effect of, you know, climate change, right? So
That's
we have
great.
all of these, all of these
Okay.
different things in the hopper, but we need collaborators and funding, honestly, to proceed with them. But I 100% have planned to make those plans transparent so that we can get funding and we can get the members to drive that work plan. We are, you know, a member-driven organization, so the prioritization of that is driven by the collective, and you are a part of that.
Right. I guess I was hoping that if there is demand for further Gravity work, these pilots might be a source of that demand, which in turn would reinforce your search for the kind of support that would make adding domains to Gravity possible.
That's a brilliant idea, Lucy. Thank you.
Thank you.
Any other questions on Lucy's brilliant idea and the feedback we're looking for on goal statements and intervention terms? I did see a comment from someone regarding health systems. I can't see it because the chat disappeared. So if somebody wants to unmute or elevate that question so I can understand. I think it was from Heidi McPherson.
I'll add, Sarah. It's Heidi asked if we are looking for healthcare orgs to respond or collaborative efforts seeking to promote their use.
Both, everyone. We want anyone to respond. We need help analyzing the usefulness of the terms we created. So however you see yourself in that answer, we would love to work with you. I hope that was a good answer. It's a classic Gravity answer. Come play. We would love to have your help. The tent is broad. Fantastic. All right, and I did see that Vanessa dropped the sponsorship element. I mean, I think everyone who's on this call is aware that we do work with a very trim budget. So again, the specific domain build and that new work is dependent on having funding. So if anyone wants to become a sponsor, that sounds great. Again, deep thanks to RWJ and Civitas for supporting the pilot implementation work, and for ONC and ACL and IAG and AARP for supporting our phase 1 work. All right, I think we're ready to go on to the next slide. Was open discussion, I know. So we've covered a few things so far. And again, I apologize for being, if I'm a little dim today. It has been a long HIMSS week, so this is the end of it for me. We've covered the kind of grounding and the approach of the pilot workstream. I really hope you heard that if you're out there implementing and you're not a pilot, we want to hear from you. We want to hear what you're doing. We want you to share your approaches. In line with that, I want to note that if any of you go to the pilot Confluence page now, it has a little bit of a different structure that we're hoping makes it more accessible to you. So there's that list of the supported pilots, those pilot supported partners, but there's also a list of anybody who's piloting, right? So when you sign up for the pilot affinity work group, you get to determine what kind of engagement you want to have. So if you're implementing in that space and you want to let us know, or you want to be on the list of implementers in your setting, please just put that information in or send an email to gravity@ehl7.org or to Heidi, or put something, just communicate to us so that we can make sure that we center your voice, because we want to broaden the tent as we go forward. And then I hope you heard how exciting it's going to be to work with those phase 2 pilots as we approach those public health and health equity use cases. And I really want to make sure you heard that we're also supporting our pilot phase 1 as we go forward. Any questions before we move on? Feel free to unmute your mic and just ask questions.
Yeah, hi, this is Amanda from Pima County.
Hi.
Hi. I put a message in the chat. I just wanted to emphasize it, like with my voice as well. So our listing is Pima County Southwest Tribe. The reason why we use Southwest Tribe is because our partner doesn't wish to be named. And so I just want to ask everybody in this meeting to respect that. You know, if you're talking about any of the pilots outside of this meeting, you can just refer to them as Southwest Tribe.
Thank you so much, Amanda. That's really important.
Yeah.
Shelley's asking for a link to the Confluence page. Any other further questions? Sarah's put a link to the pilot workstream Confluence.
Hi everyone, my name's Abby. I work at Contexture as a health informatics analyst. I have a nursing background. There was a link that was dropped in the chat. It was a value set, I believe, in VSAP. I'm just kind of taking a look over it during this call. And I noticed the code set from this value set is only SNOMED. So my understanding that during this phase 2 pilot, that only facilities that can accommodate this value set within their EHR are the ones participating. And how would they then capture, I suppose, if they're not using SNOMED CT, or it's not part of their EHR?
So that's a really good question. That was a limited picture of some of the terms we have and some of the types of codes. In an upcoming slide, we're going to show you all the different terminology types that we have to offer.
Oh,
so yeah, so if you're not using SNOMED CT, there are other options like in order to participate in the pilots.
Got it. Thank you. Appreciate it.
Yeah. Any other further questions?
Hi, this is Karen from Z Omega. How do you, if you just go to the Confluence page to sign up to pilot?
Yeah, so there is so there's a couple different ways. You can go to the Confluence page and register for the work group, the Pilot Affinity work group, and then put it that you're interested in piloting, because if you determine that you're a member, it means you're committed to piloting. Member gets used a lot in Gravity, but in this instance, it means that I'm committed to piloting. Or you can just simply send us an email at gravity@hl7.org or to Heidi Phoenix at Civitas Networks for Health, and we will absolutely reach out to you and connect and see how we can pilot together.
Okay, great. Thank you.
Any other questions? I'm really excited to hear that people are interested in piloting. Again, we're really, really focused on trying to expand the tent. Any other further questions before we move on? Again, this is a brief meeting because of HIMSS, because of time constraints, and just need to kick off the Pilot Affinity phase 2 work. All right. Okay, I think we're going to pivot now, and I think this answers one of the questions we heard earlier. So I mentioned this earlier in the call, So one of the focuses of the RWJ funding and our collaboration with Civitas is really listening to implementer feedback on a couple elements. One, the complexity of the Confluence page. We heard very loud and clear. I think it actually was a direct point of feedback from our partners at Ocean. The complexity of the pilot page, navigating it if you're an implementer. And we also know we have to support all of our implementation sites, we also have a need to develop education materials to support implementation. So RWJ and Civitas are partnering and supporting this work. And so there's a lot of things to report back. The focus of it is improving education dissemination, centering community voices with virtual co-design sessions, and building more accessible resources focused on supporting Gravity standards and implementation needs. Next slide, please. So in light of that, there's some really important Gravity Confluence updates we're really happy to focus on. So these are live and in the ecosystem right now. They're really trying to lean into addressing implementer feedback on the need to easily find core deliverables. So you can find those in two different sections. So first of all, there's a general new landing page about how Gravity fits into the broader social care ecosystem. And there's a specific area, the new resources that we just knew, which is called the resources for implementers. It includes a general resource library. It includes terminology resources, which are links to all those terminology value sets. And it includes technical resources, which is the SDOH Clinical Care Implementation Guide. Also, on the right top corner of the Confluence, you can find, or below, if you're on your phone, in the quick links section, you can find direct quick links to the terminology value sets and the implementation guide, right? And if you see, that was one of the questions, all of the different types of the terminologies are referenced in the value sets of reference. So we have the LOINC terminology for screening instruments. We have IC10-CM diagnostic terminology and SNOMED CT diagnostic terminology for diagnoses. And so if you don't see yourself in SNOMED CT, there's an opportunity to leverage those kinds of terms. IC10-CM is a really critical term for community-based organizations and payer partnerships and provider partnerships. And then also in the patient-centered goals and intervention section, you see that we leverage SNOMED CT, CPT, which has some limitations and applicability, and HCPCS, which are more used than ever in community-based organization and payer partnerships, especially when we consider referencing the new, like in lieu of services rule. So all of those value sets for each of our domains are now in that resources for implementer section, and they can all be accessed via the quick link section. So if you're trying to implement Gravity terminology, you want to know the right value sets to use, I hope you find that we tried to make it a lot easier for you. And also, I hope it made it easier to find the SDOH Clinical Care Implementation Guide. And again, thank you for Ocean for spurring us on. We appreciate your feedback. We really tried to lean into it as we made it easier for implementers to find our work. Any questions here? All right, so pivoting to the next slide. Oh, yeah?
Sarah, sorry, this is Jess Little at Civitas. I just wanted to also add, when we are thinking about this next phase of work and the different resources and work streams that are happening, just wanted to note that in addition to the educational materials and resources and supporting the pilot sites with technical assistance, we also want your feedback throughout the upcoming months. And as we hear recurring themes on areas of opportunity or areas for training, we will be doing some kind of one-off trainings or series of trainings on specific topics that will also be open to all. So really looking for opportunities for all of you to kind of further engage in training opportunities over the coming months.
Thank you so much.
Jess, that's awesome. And Sarah, that's wonderful. I'm Vanessa Kindler. I'm the program manager for Gravity, as Sarah kindly introduced me at the beginning. And all this great work, we're really working hard, as you can see, for many opportunities for different folks at different phases of their journey, leveraging the Gravity standards to get involved. And some upcoming events we're going to talk about include the HL7 Working Group Meeting Plus, which is happening in New Orleans this year from May 8th to May 12th. For those of you that are less familiar, the HL7 International has 3 working group meetings a year, and this one is a little bit different. It has a plus sign at the end of it, which means it's a little expanded. And so they have an overall theme of the role of policy in the advancement of healthcare interoperability standards development and adoption. And so they're really bringing in content for all levels, including leaders and experts from across the healthcare and social care continuum. So it's an opportunity for people that are new to FHIR, or for those who just want to learn more on what they already have. And there's going to be sessions, keynotes, general sessions from the HL7 accelerators, including the Gravity Project and others like Helios for public health, as well as educational sessions. So implementation guide, deep dives, if you're getting into FHIR a little bit more, or the terminology of Gravity. There'll also be demonstrations and other sort of hot topics happening in that HL7 community. And so we hope you can join us. If traveling is not really your thing or not in your budget in this time, there will be portions of the Workgroup Meeting Plus for a reduced rate that are available virtually as well. So check out the agenda and you can see if there's any sessions that may be right for you. I'll also call your attention to the HL7 FHIR Connectathon in May, which is both virtual and in person over the weekend prior to the workgroup meeting, as well as the CMS HL7 joint virtual Connectathon happening in July. Both of those events will have a Gravity track to test our implementation guide for social care, and it's really all about hands-on testing. It gives folks an opportunity to get their hands dirty and learn by evolving the FHIR specification through development and testing. So developers can come together wherever you are in your journey. And if you're interested in joining, you can click on that link to learn more or reach out to us at gravityproject@hl7.org. With that, I'll turn it back to Jess, I believe, unless there's any questions.
All right.
Thank you. Jess, you're muted if you're talking.
Heidi, do you want to leap in to speak to this if Jess is not able to speak, or do you want me to try?
I can go ahead and jump in on this. So we just wanted to draw some quick attention to the Civitas for Health annual conference. It will be happening in partnership with our Chesapeake Bay region members, and it will be in National Harbor, Maryland, right over by Washington, D.C., August 20th through the 23rd. And we have announced our keynote speakers, Dr. Judy Monroe, Brian Castrucci, Ann Zink, and Stella Sappho. We are so excited to have them. And we are really looking forward to this as an opportunity to be able to, bring together our pilot communities if they are able to attend, bring together really, Gravity members will have opportunity for, networking and being able to actually have, Gravity present on a panel and be able to feature them. And they're going to be presenting on the importance of furthering SDOH data standards and their implementation to achieve interoperability, centering the voices of those who face barriers doing this work. And so we're really excited about that opportunity and really look forward to having anyone who's able to attend and being able to facilitate attendance as much as possible. And I will drop a link in the chat right after this.
This is Sarah. I'm just going to add on to that, if that's okay.
Yeah, please.
So if you are a member of Gravity and you see yourself in the centering the voices of those facing barriers doing this work, please reach out to me, right? So we're trying to identify the right person to include in that panel. We really want to make sure that we leverage the voices of everybody who's here on the call and outside of the Gravity community. we want to make sure that we're not painting a rosy picture, that everything's easy peasy in the social care data standardization world. So if you see yourself in that last element, just write me an email. You can write gravity@hl7.org and find a way to me, or you can find me in many of the ways you know how to find me. So we look forward to ensuring that we have the complexity and breadth of Gravity perspectives on that panel. Oh, David. Hi, David. Any other questions?
I would add at the conference, we will also be looking for opportunities to bring folks together for small group conversations and really learning opportunities related to Gravity implementation. So, you know, the panel will be set, but we're also looking for additional opportunities. So just stay tuned for more. And again, we are open to feedback and to better understand the interest from the community to come together in person in August.
All right, next slide, please. I believe I'm going to try and see if I can help carry it out. Unless, Jess, do you want to keep on going just for the sake of ensuring that I don't leave in order to run to my talk?
Sure, sure, I'm happy to. So we did want to make you all aware of a funding opportunity through the CDC focused on cardiovascular disease and looking at the social determinants of health and how to address SDOH factors that can lead to progression of hypertension and hypercholesterolemia. This is the second phase of work, really leveraging the first phase of lessons learned from a previous funded opportunity. So we'll drop this link in the chat as well to this opportunity. And I would also add, if anyone is interested in partnering or looking for particular partners to go after this funding opportunity or others, please reach out to us, and we're happy to help make connections across the Civitas and Gravity communities and beyond to strengthen proposals. All right, so next slide. So if you're joining us today, you likely have signed up for the Pilots Affinity group, but if you have not done so, we'll share this link to Confluence as well so that you can sign up for the full series. Again, if you missed the beginning of the conversation, we have just entered phase 2 of the Pilots Affinity group, which will be Gravity project leaders that you're all accustomed to, now supported by Civitas Networks for Health. So if you see communications coming out from Civitas, including the invitation to the Pilots Affinity group, we're happy to answer questions on that partnership. We'll also be posting the meeting schedule and materials, both the slides and the recordings on Confluence. And we'll send all of this information in a follow-up email. So if you missed the link in the chat today, do not worry. We'll send all of the resources that we're kind of curating throughout the series and the ongoing affinity groups in follow-up to the calls. If you have questions, go to the updated Confluence page. We're excited to hear from you and get your feedback on the updates to that page. And also, again, feel free to reach out either to Heidi Tenix related to the pilots, or if you have general questions related to Gravity, reach out to us at gravityproject@hl7.org. And then here's just a list of other opportunities to engage. Again, there's multiple opportunities through the pilot Workstream, through this affinity group, through the education and resources opportunities, but there's more offered by Gravity in supported by Vanessa and others at HL7. So the terminology workstream meets bi-weekly. The technical workstream also meets bi-weekly. And then the pilots workstream, which you've all joined today, which is meeting monthly. Moving forward, it will be back to the last Thursday of each month from 2:30 to 4:00 p.m. Eastern time. And again, visit Confluence or the HL7 calendar for meeting details and materials in follow-up. And as always, we welcome you to become a sponsor or a member of the Gravity Project to keep this important work moving. So before we wrap up, Vanessa, any closing thoughts, or Heidi, or any questions from all of you that are joining us today?
I will just add thank you so much for all of the hard work, and to all of you who are participating in this Pilots Affinity work group going forward. We're really excited for this phase 2 of the project and with our partners at Civitas, and truly grateful for all the wonderful work that's happening here. Thank you.
I had posted a question. This is Anjum Khurshid from Harvard Medical School. If you could restate if the defined deliverables for this affinity group are under the contract, are they specifically defined, or it's mostly to identify collaborations?
Yeah, this is Jess from Civitas. Great question, Anjum, and thank you for asking. So for the Pilots Affinity group, we will have already started really looking at needs assessments for each of the 4 pilot sites in the second phase of the work. So some of the activities and deliverables and TA will be really specific to each of those sites. So each of the 4 pilot sites will be receiving targeted technical assistance. As I mentioned previously, we'll also be spinning up trainings available to the broader community over the coming months. So virtual webinars or a series of trainings on specific topics. The educational resources Workstream is another deliverable, and you'll see more communications coming out about updated resources over the coming months. We're also hosting a number of co-design sessions, which again, you'll be seeing communications and opportunities to engage in those co-design sessions, really looking at what are the gaps in those resources that are available to support specifically implementation of Gravity standards and participate in co-designing future opportunities and materials. We will be offering an in-person meeting to each of the 4 pilot sites as part of this program. And again, opportunities for the broader community to engage at the Civitas annual conference in August. So Heidi, did I miss any opportunities or any deliverables as Anjum to address Anjum's question?
No, sorry. Again, view button. And I was just also specifically stating in the chat that, the purpose for the affinity group as well, which is just the peer-to-peer learning forum for those entities that are participating in the real world testing of Gravity standards, to be able to learn from one another and be able to offer support and help one another. And so with the pilot communities, we are also supporting and learning from the pilots, and then this is a place for organizations to also learn from one another. And so I think that's the deliverable for the group, not a specific deliverable, but to be able to learn from one another.
And the last thing I would add is that it's really important for the Gravity community, Civitas, for the Robert Wood Johnson Foundation, to really have a feedback loop, as Sarah discussed earlier. So we want to make sure that, yes, we're providing training and technical assistance and supporting the work that all of you are doing to implement Gravity standards. And we want feedback along the way on how we can improve throughout kind of the life cycle of standards development all the way through to implementation and evaluation. So that will be something you'll be seeing coming up over the coming months, as well as just more opportunities to provide feedback into the processes along the way. So we're grateful for that.
Can I follow up on the last question? This is Lucy Johns. Pilots often have either explicit or implicit intention to be replicable. In other words, it's often a purpose of pilots to discover common themes or needs or requirements or whatever, so that pilots, whatever the subject matter, can be replicated. So I'm wondering, to follow up on the last question, whether you anticipate in any final products discussion of replicating, aside from the necessarily unique and fascinating elements at each individual site and what more they may need. So is replication in your worldview?
Absolutely, and I can answer that because that's something we've talked about a lot. And I know, Kate, who's also on this call, it's something we are working on, like specifically being able to put use implementation frameworks as we're thinking through things, and how to ensure that the work the pilots are doing is replicable, and to be able to think through what it means to actually implement and be able to have actual outcomes that are replicable, instead of just looking at it as each individual project being something unique that we look at and then goes away. And so documenting.
That's great. Okay,
aspects,
thank
yeah.
you.
Oh yeah, no problem. It's something I really like. So I think, but yeah,
Okay.
being able to document every aspect of the implementation. So we're actually learning from each different project what they're doing and what works, and what another entity that's doing something similar might be able to replicate, learn from, and then scale.
Excellent. Thanks a lot.
Yeah, no problem.
Yeah, that was a really great question, and I'm glad you asked it. I think it's critically important, and that ability to replicate and scale what can be scaled across different regions and different communities is really core to what we do at Civitas. And I would, I think I speak for the Gravity community as well, right? We don't need to start from scratch, right? This work is hyper local, and there are obviously very specific policies and partnership and variables within specific communities that need to be kind of modifiable, but there is so much that can also be replicated and scaled from one community to the next. And we're absolutely here to support that and ensure that no community has to start this really difficult work. So thanks for asking.
People like me participating here are really looking forward to that. Replicable elements, things that you must pay attention to, things that you really don't need to do right away, but if you do, the chances of success are greater, and so forth. Thank you.
Thank you. Any other questions as we wrap up our time together? Okay, well, hearing none, just want to thank you all so much for joining us today. We know that we shortened today's meeting, but look forward to our longer meetings coming up to hear from all as we move forward. So thanks so much, everyone. I hope you have a wonderful afternoon.
Thank you.